Hello, everyone. I am looking forward to what I am confident is going to be a very thoughtful conversation with Wendy McSparren. She is the founder of Admira and WPA. Welcome, Wendy. Would love you to give the audience the basics of what those two companies do in the world.
Hi, Dan. Thanks so much for having me. I really appreciate it, the opportunity to talk with you. So, WPA Therapy, which is Westmoreland Psychotherapy Associates, is my group practice that I launched in 2020 during the pandemic when the need for care was just exploding and my phone was ringing off the hook. And, my husband looked at me and said, "You aren't scalable. You really should consider a group practice." And I've been doing this now 37 years. I've been in the field and I've run other programs in other systems. I wasn't sure I wanted to go back to running a larger program. Solo practice was okay for me, but I couldn't say no to people who were desperate for help. And so it just made sense. And I started growing my practice. And with that, the administrative chaos, all the things I kept in my head that I knew intuitively and I could do, and I had, you know, notebooks and spreadsheets and all the things to try to keep myself organized, just at some point could not keep up with the growth that we were experiencing. And as a result, my husband, John, and my co-founder of Admira, he is a software engineer. And he said, let me look into getting a CRM and starting to put all these systems together to duct tape them. And we tried that, but none of them really fit for mental health care or healthcare in general. And so he felt like it would be easier if we just built the software from scratch, which is what we started doing. And since we were in lockdown, we were here in the house trapped together and we had a really tight iteration loop, and we were able to really build Admira as, and it sort of started as a CRM, customer relationship management system
Mhm.
that was really highly niched for behavioral health. But it's really become so much more. I mean, it is an operations system that really allows you to grow your practice in an organized way and get all of the things out of your head and off of spreadsheets into one place. And it sits in front of and behind the EHR, to be able to manage your practice for all the things that your electronic health record just doesn't do for your practice.
What are some of the principal gaps in EHR systems that you see?
Well, I think our EHRs are set up for documentation once somebody becomes a client or a patient in your practice, and they're set up to do the billing. In terms of when a client is reaching out for care, I don't know that the EHRs do a really good job of giving you space to have those referrals come in so that you can determine if that is an appropriate referral for your practice, help the person determine if their insurance will cover it, provide them a good faith estimate, whether you're an insurance-based practice or a cash-based practice. So that whole referral flow, the EHRs do not manage well. I think some of them try to do it on a late basis, but not in the way we need to be able to really connect a person to care in a way that is aligned with care and not just being a sales kind of thing. Because CRMs, most commercial CRMs or sales CRMs are geared towards sales. And although we're a business and there is a certain part of sales, we offer care. And so, the person coming in is often in a vulnerable place, and the ability to meet them and nurture them through the process and get them where they need to be, whether it's with your practice or referral out, is really important. And then on the back end of things, The payment process, like when claims are denied or people are behind in paying, there's no great system in the electronic health record. You can get reports about it, but there's no system to work that process of getting your claims recovered or payment flow. So a lot of people use spreadsheets to do that. And again, that can be helpful to a certain volume, and then the information is overflowing. So, and with that, with both of those, the front end and back end, w- we need analytics to understand what's working and what's not working. And so those analytics aren't necessarily available in our electronic health record. And that's been something we've been very committed to in building in Admira is you have really clear analytics about what's flowing into your practice and what some of those other operational tasks are and workflows are and how those are functioning in your practice.
There's a lot there. There's a few different directions I'm tempted to go in, but maybe as a starting point, so many practice owners who grow to a true group practice are what are sometimes called visionaries. So these are people that see a lot of different possibilities, and they see what their business could become. They see what clinical care could become at their practice. And typically it's less likely that someone that has that general orientation is going to be great at systems creation.
Mm-hmm.
There's a level of sitting back and focusing on the details of documentation, of ensuring that there aren't, that as many gaps as possible are being filled. And so
Mm-hmm.
typically I think that those two mindsets, those two tendencies are at odds. To fill those gaps, it can be done. And I watch myself and other people that I would call kind of visionary entrepreneurs. There's a tendency to fill those gaps through, what's the word I'm looking for? Duct tape is the term you used,
Yeah.
right?
Mm-hmm.
And sometimes I definitely am duct taping things.
Yeah.
And that's one level of awareness. That's one level of commitment to solving the problem. And then a second is switching a lot of your mental energy over to a whole other system, is embracing one system as a way to unite all of these sort of disparate elements together.
Mm-hmm.
How does a visionary entrepreneur make that transition? Because it can be psychologically tricky for them.
And you can get caught in I think sometimes the minutia of tasks and just trying to get things done. And creating a little bit of space to be able to toggle between the macro and the micro of what your business needs and where you're going. I think you have to create some of that space. And it's really hard to do when you're building a practice because there are so many day-to-day things you have to live in and make sure they are completed. So, I think it starts with creating some space that's protected so that you can really think about what's happening in your business. And I'm a licensed clinical social worker, so my whole background is in systems. I started out as a family therapist with children and adolescents, so it's all about the systems. And so many of us as clinicians are trained in systems theory and working with the families or couples. And I think there's a skill set that's transferable to the business. You really start to look at your business like a family system and start to build a treatment plan almost for it in terms of setting some goals and figuring out, what's happening in the system with the different parts and how that is affecting the whole. And then what are you going to do in terms of supporting and intervening in that system? If you think about a mobile, like if one part of the mobile moves, it moves the other part of the mobile. So that whole system is really connected. And when you can step back with your clinical lens, that actually is really a huge strength in kind of managing the system of your business, I think.
So interesting. Yeah, clinicians do have a tendency to think of in interdependent terms. And you're right that a group practice is a very kind of interdependent organism. And if there are significant gaps in an EHR, like we've been talking about with referral flows, then the flow of the energy around the system is disrupted.
That's right. That's right. and chaos ensues. And, no matter how good we are, that translates to your clients on some level, whether phone calls aren't being returned or things fall through the cracks, it starts to leak out that way.
I very much appreciate your point about the importance of referral flows and how the status quo and EHRs don't do a wonderful job there. And one of the really unfortunate things is how many people need care and are either faced by a faceless CRM or a very broken, we want to help, but it's sort of messy. So creating experiences for people is so important to ensure that they're willing to enter a moment of even deeper vulnerability, right? Which is going to be required for them to heal.
That's right. That's right. And the other thing is most sales CRMs stop once the client has been transferred into the EHR. And that's something that our system in Admira, we follow the client throughout their entire journey within the practice, which is, not something other softwares really do.
Can you share more about how that works? What are the outcomes that clients experience, and how does Admira follow them through their journey?
So we are able to connect with a few electronic health records to be able to push some data in to the electronic health record, but we also have a current client's workflow within Admira so that then you can, if you are wanting to share a new service that you have in your practice that some of those current clients could benefit from, you could segment those out and you can do an email campaign to those people so that you can share that information to get other services that they could potentially benefit from and have that information. So, we're able to connect with some EHRs and share that data. And then when someone is discharged, we can do that also in Admira. And so then what clients are active or inactive in both the EHR and within Admira. And again, you can you know, it's funny, I had this conversation with another practice owner about, she doesn't really see it as a client being discharged. Once they're part of their practice, they're always part of their practice and part of that community. It's so there are services and things that we want to share with people who've come to us in the past and if they need us again in the future, how do we keep that connection with them and nurture that relationship with them or people that they love and care about that might benefit from services in our practices, right? So we really have that. We're monitoring it in both the CRM operation software and in the electronic health record.
Talk therapy is ultimately a very human journey. And so it shouldn't be a surprise to anyone that a huge percentage of people that find their way to group practices find their way through referrals.
Yeah.
And systematizing referrals is not something that's generally been done well.
That's right.
And creating the space to make it really easy for people to do referrals. To my knowledge, it hasn't really been done well. And the practices, having looked at over 80 of them, having looked at some of the larger ones in the country, if they could really nail their referrals, I think it's a tremendous business and care opportunity.
I agree with you. We talk about that a lot as a team, and even just developing referral partner relationships. That is something that Admira has, that referral partners can do a very easy, simple referral into Admira from, whether it's a primary care doctor
Yep.
or an audiologist or a dietitian.
Yep.
We offer that so that they don't have to fill out an entire form and send all these documents over because we have to make that process simpler.
We do. We do. So referrals, anyone who runs a service business knows referrals are just so valuable, and especially so here in the therapy world, What bottlenecks do you really see to referrals? And can you share, you shared a little bit about how filling out a whole bunch of forms sounds like it's going to be a bottleneck to a lot of referrals, but can you walk me through in a little bit more depth if I'm a GP and there's a therapy practice I know in the community, maybe I'm referring to them for the first time, maybe I haven't had much connection with them. How can Admira facilitate that referral?
So we have a much shorter referral partner form. And so, as you are also nurturing your relationships with potential clients, you're nurturing relationships with other providers in your community. And, we just have that form be very simple. And then we'll call the client. Because lots of times, a primary care doctor, the ones I work with, would always give our card to their patient, and then they hope that the referral gets there and gets scheduled. And with the referral partner form and program within Admira, literally the physician or the physician's assistant or the nurse can just pull it up and do a very quick referral right then and there to that form. That's short and sweet. And because it's set up with automations, they will get an automatic email that tells them we've got it. And the client is already starting through the process of, being contacted and determining if that practice is appropriate and we can provide that service.
Got it. Okay. So Admira isn't making the phone call, but the practice that is that's receiving the referral, someone, their admin person, their office manager is going to pick up the phone and call.
They can call or literally fill out just a quick form online, and it goes directly into Admira. And then, the automations and our team pick up right then and there and start reaching out to the client directly to get them an appointment.
I'm curious, do you have any data on the extent to which this has improved referrals for practices?
I don't have specific data, and I think it's a good point. We need more data about this. I think there are practices that have very specific referral partner relationships. They might have a contract with a particular entity. It might be formalized, it might be informal. I know the practices that are using the referral partner process find it incredibly valuable, and it just makes it easy for that busy practitioner, in their own healthcare practice to get it to the people they know and trust in the community.
Switching gears for a moment, you mentioned at the beginning that, you started WPA before you started Admira, and you were really solving your own issue with WPA. And you've told me that WPA remains a laboratory in a lot of ways where you can test new features of Admira, test new ideas. Can you speak to that process? I think listeners will find it interesting.
Everything that we have built and deployed in Admira is something I've used in my own practice because I had the need. And even with our customer advisory board and the people, I'm being informed by practices all over the country about similarities and differences between my practice in southwestern Pennsylvania and their practice somewhere else in the country. And they have really great ideas. So, we are really involving our customers in giving us information about how to make the product helpful and meaningful and useful for practices of all kinds of variations. And with that, I test every single thing in my own practice. So, for example, we're seeing more and more AI receptionists. And we currently have that feature in Admira, and that has been being tested in my own practice before we deploy it, because I want to know exactly how it works and how it sounds and where it might miss something, and how do we train the AI receptionist for crisis detection, and what do we make sure that it is doing to get that person to a human being to get the care they need. So that's just one small example of something that we always beta test it in my own practice before we deploy it.
An AI receptionist. That is a fascinating concept. And as relational a field as ours, I can hear some audience members freaking out a little bit at even the mention. But it sounds like you believe there's some potential there.
I am cautiously optimistic about it. Listen, as a culture, we're all used to calling and getting in some cue with some analog, voice something.
Yeah.
And I notice that I have a lot of hangups when it's just going to my voicemail. I would rather have a live answer of some sort at my practice with somebody who's calling at 11 o'clock at night when they are struggling. They
Yes.
can choose to it's basic information. Let's get you scheduled for a 15-minute consultation call tomorrow morning. And to get you the help that you need. Because, when our practices are closed and we don't have any kind of live answer, people fall through the cracks. So, and the AI thing, again, I get it because I have conflicted feelings about it. It's not going to replace human beings in therapy and what we do in our relational business. It is going to be able to help us with repetitive tasks, to manage our operations, I think, in a big way. And I'm excited for exploring it in that way, not to replace the human being at all.
Yeah, the reality is AI is here, and in general, we are going to have to find ways to human and AI will have to find ways to work together and accept each other.
Yeah, I agree. And this AI receptionist, the voice is so much more human. It identifies that it's AI. Just like when you call your utility company and they say, this call is going to be recorded for blah blah blah. It's actually a lot more pleasant than those analog voices that we're used to listening to when we make a call like that.
We probably all had the experience of being a little triggered by those, right? So it'll be very interesting to see if something like that gets rolled out, which I imagine it will, more broadly at some stage. It'll be interesting to see what people's reactions are and whether the analog voices are, we, of course, in a perfect world would have humans doing everything, but we don't live in that perfect world. There are efficiencies that we need just to be able to function. And so it'll be interesting to compare if there's a middle ground between analog and human.
Absolutely. Yeah, and for me, again, if I'm gonna put this on Admira, I have to understand it and test it and be comfortable with it in my own practice, and understand the risks and benefits to it.
I think that is all super exciting and all kinds of cool possibilities. And it's great that you're testing them in your own environment and before rolling them out so you can have a sense of what some of the kinks are and give users as smooth an experience as possible.
Mhm.
As we
Yeah.
come towards the end of our time together, Wendy, I always like to end on a human note and ask when you are not building Admira or you're not running WPA, what do you do for fun?
Good question. I haven't done a lot of fun things in the last 2 years, but John and I really enjoy traveling, so we have made time for travel. And, I have a golden doodle that is also a therapy dog, and so, I do a lot of walking in nature with him and getting out and doing that, and we're about to have a 3rd grandbaby, and so, our life is shifting because the kids are adults, and we've got 2 grandbabies in Norway we're gonna go see, and one in the Gettysburg area will be born in July. So that's going to be shifting a little bit of our focus and supporting, you know, grandkids and enjoying that a little bit.
Thank you for coming on. What a rich, interesting discussion that I'm sure people will pull some nuggets from. So thank you.
Yeah, thank you, Dan.